Hi, very good afternoon, everyone. Myself, Dr. Vachini Bhatt, and welcome to the Friday Facebook Live. World Hepatitis Day. Every year on 28th July, this day is celebrated worldwide to bring the awareness regarding the hepatitis and other liver diseases. It provides the platform for the education, for the engagement with the government, healthcare sectors, as well as for all of us to bring the awareness to eradicate the viral hepatitis. And for this, we have planned this talk show with our expert of Marengo CIMS Hospital, Dr. Bhavesh Thakkar, who is a consultant gastroenterologist, and Dr. Vikas Patel, who is a consultant liver transplant and HPV surgery. I welcome both of you in the talk.
Thank you.
And let's begin with the viral hepatitis and the general everything regarding the hepatitis and the liver transplant. So my first question is to you, Dr. Vikas Patel, that just please explain the theme of this year of hepatitis.
So, World Hepatitis Day is celebrated every year, and it comes up with a theme every year. So, theme this year is, they say, it's time to act. That is the theme. And what is the meaning of this theme? So, basically, if we see the burden of disease of hepatitis all over the world, it's huge. Every 30 seconds, one person dies because of viral hepatitis. And every day, 3,500 new patients are getting viral hepatitis. Of course, we do have in India a very good way of controlling few types of viral hepatitis. But if we see the world all over, it is not the same. The burden is so much that, as I said, there is a lot of mortality. And so, to reach the target of eradicating the disease viral hepatitis by 2030, we have to work very hard. And that is why it's the time to act.
Exactly. So awareness is a very, very important when we are talking regarding the hepatitis, right? And as you have rightly said, the mortality rate is going to increase day by day, and that's why the awareness can be a part of prevention, right? Dr. Bhavesh, my next question is to you. Just continue with this question that why it is celebrated on 28th July?
It is celebrated on 28th July because the scientist, who is also a Nobel laureate, who received Nobel Prize for that, it is named. It is on the name of hepatitis B detection.
Okay.
Mr. Dr. Baruch Bloomberg, who discovered hepatitis B virus, and that saved lot of people's life. And due to that, he developed vaccine also. For that reason, remembering him, we celebrate on 20th July because 28th July 1925 is the birth date of Baruch Bloomberg. To remember them, to give honor, to respect him, we celebrate World Hepatitis Day world over on 20th July.
Okay, and we talk more regarding the hepatitis, then what are the different viruses which can cause the hepatitis?
Yeah. See, there are viruses when we classify for hepatitis, they are the hepatotropic viruses
Okay.
that infect primarily liver, and others are non-hepatotropic viruses that incidentally infect the liver or accidentally infect the liver and they damage other organs more. Primary liver is less damaged. But what are we concerned about? We are concerned about hepatotropic viruses. They are hepatitis A, hepatitis B, hepatitis C, hepatitis D, and hepatitis E.
Okay, so these are the different viruses which can cause the different type of hepatitis,
Yes,
right?
yeah.
If we talk regarding the clinical picture or the symptoms, then what it is?
See, hepatitis is like any other viral illness to start with, but progression is different. When hepatitis develops, usually patient presents with the non-specific symptoms like weakness, tiredness, fatigability, muscle pain, generalized body pain, and loss of appetite. Along with that, nausea and vomiting predominates. Usually, initial 5 to 7 days, patients have these primary symptoms. In the second week, usually by the end of first week and starting of second week, they develop yellowish discoloration of urine and eyes. By that time they present to the doctor and they meet doctor that I am developing yellow urine, I am having yellowish eyes, so now what should we do? And by that time they get diagnosed of that.
Okay, Dr. Vikas Patel, let me just add one more question in this series, that if we talk regarding the diagnosis of the hepatitis, what are the lab investigation we should go for that, and what is the treatment part?
So if we talk about the diagnosis part, so most of the patients who have infection with viral hepatitis, they have a very specific set of symptoms. So these symptoms, as Dr. Bhavesh said, will point us towards the case of hepatitis. Apart from that, which type of virus is causing this hepatitis? If we want to know that, then in that case, we have a specific viral serology which will tell us is it either hepatitis A, B, C, or E. Apart from that, what is the extent to which this virus has caused damage to liver? We want to know that. Then we do serum that is called liver function test, that is SGPT, SGOT. We get done serum bilirubin levels. So these are the few reports which will tell us about the injury to the liver. Now, if this injury is prolonged and it is so much that it is causing liver failure, then few reports like prothrombin time can prolong. Apart from that, serum bilirubin is very high in those cases. And in case of those patients who have fulminant liver failure because of untreated hepatitis B specifically, they will have effect on brain that is called hepatic encephalopathy. Person becomes sleepy and he may not respond well. So these are the few symptoms and laboratory investigations which will tell us that there is viral hepatitis and it is serious or not serious.
Okay.
And for the treatment part, so specific antiviral treatments are available for hepatitis B and hepatitis C. So we can give medicines for hepatitis B, which are, for example, we can give entecavir, we can give tenofovir. For hepatitis C, a very effective treatment is available in our country since 2015, and it is a specific combinations of directly acting antiviral medicines, and this has caused the incidence of hepatitis C to reduce drastically in our country. For the other hepatitis virus like hepatitis A and hepatitis E, we do not have specific effective antiviral therapy at present, and these diseases are self-limiting. That means that body's immunity will help in recovering the liver from this viral hepatitis. So within a span of around 10 to 15 days, the person will recover slowly, and the enzymes SGPT, SGOT, apart from that bilirubin, that will start to reduce by itself.
Okay, so Dr. Bhavesh, we have talked regarding everything regarding the causes and the clinical picture, diagnosis and the treatment, of course, by Dr. Vikas Patel. But our main focus is, we always believe that prevention is better than cure. So just let us know that what are the preventive measures which can be taken.
Yes, Dr. Vachini. So now when we talk of prevention, it comes that first thing, how people get infected with that viruses. Now, if we see out of this A to E viruses, hepatitis A and E virus is foodborne or waterborne virus. Like we get GI infection, along with that contaminated water, infected food, that causes hepatitis A and E. And as mentioned, they are self-limiting disease. If we want to know how to prevent hepatitis A and E, we do have a hepatitis A vaccine available. Hepatitis E vaccine is not available for general population. Nowadays, pediatricians give in childhood hepatitis A virus vaccine, and due with that we can get lifetime protection. If a person is not protected or not got infected during childhood, adults, if they have checked for that, we can give hepatitis A vaccine to prevent hepatitis A. Or better way is to have hygienic food, hygienic water, so that we avoid that. Now comes hepatitis B and hepatitis C. These are the two deadly viruses. They cause chronic hepatitis B and chronic hepatitis C. And that on long term can lead to cirrhosis and even liver cancer and even need for transplantation. Now, how can we prevent that? How can we get protection from that? Hepatitis B and C viruses are usually transmitted parenterally, like blood transfusion, unhygienic instrument used during surgery, or needle stick injury, or unprotected sexual intercourse. Due to that, we get hepatitis B and C viruses. Now, one thing.
Yes.
For preventing aspects, hepatitis B is easily preventable by vaccination. Since 2006, government has introduced a program to vaccinate all the child for hepatitis B, and due to that, 2006 onwards, everyone is being vaccinated. But those who we are adults who are born before 2006, we are not vaccinated. So ideally, all the adults who are born before 2006, they should get vaccinated.
Exactly.
Hepatitis C, we do not have any vaccine available up till now.
Okay, sir. So you have used few words regarding like liver cirrhosis, fatty liver, liver damage, and liver transplant. So let's begin the talk for the liver transplant. And first question to you is, what are the main causes which can damage the liver, and someone has to think or opt for the liver transplant?
See, any injury to the liver by any means, that means viruses or other. Others include normally alcohol, hepatotoxic medications, hepatitis viruses that we talked. Then other is that epidemic that we are going to face or we are passing through, that is obesity, non-alcoholic steatohepatitis, or metabolic dysfunction associated steatohepatitis. Means obesity, metabolic syndrome, associated liver damage, and that we are going through a lot many patients we see nowadays, and we are on the epidemic of that. All these ultimately over a period of long term, they cause liver cirrhosis, and that will require liver transplantation.
Okay. Dr. Vikas, as you are a consultant liver transplant, so my next question is to you. If we are talking regarding the liver transplant, that word brings some fear among the people. So we want to know everything regarding the liver transplant, and let's begin with the process. What is the exact process for the transplantation?
So, first of all, we need to establish that the person or the patient is having an irreversible liver dysfunction or rather irreversible liver failure. So all those cases which have a specific treatment like antiviral medicines or maybe cessation of alcohol, in those cases a trial should be taken so that we can allow liver to recover. If we fail to recover this liver, then in that case we can consider liver transplant after looking at the patient. So, what we look at the patient? So, if we take liver, the liver is a very resistant organ. Until and unless a lot of liver function is gone, liver won't show any symptoms. Rather, I would say even laboratory reports will also be normal. So, whenever the liver dysfunction is at an extent that remaining liver is not sufficient to perform the physiological functions in the patient, then liver transplant should be considered. Even in case of cirrhosis, there is a variable time period like say 2 years to 5 to 10 years that a person can live with cirrhosis without getting liver transplant. So a person who is having cirrhosis but who is not having ill effects because of liver dysfunction, they are called compensated cirrhosis patients, and those patients will not require liver transplant until there is a decompensated liver cirrhosis. So decompensated liver cirrhosis is an indication for liver transplant. And how do we know that a patient is having decompensation? So in cases of liver cirrhosis, whenever there is ascites or jaundice, or there is effect on brain, that is encephalopathy, or patient is having vomiting of blood, that is we call in medical language as hematemesis, which is occurring on multiple occasions and difficult to treat. So these are the instances where we consider it as an decompensated cirrhosis, and these patients only should consider for liver transplant. Apart from this, there are few exceptions like liver cancer. So a patient who is having cirrhosis and a liver cancer without decompensation, he will still need liver transplant. Over and above this, there are other conditions like hepatopulmonary syndrome, in which, because of liver cirrhosis, there is an effect on the lungs and the saturation of the person remains low. In that case, also, liver transplant is done earlier. So, all in all, these are the situations in a patient having cirrhosis of liver where liver transplant is required. In a very specific situation like acute liver failure, in which liver starts to fail suddenly over a period of hours to days, in that case, liver transplant is done on an urgent basis. And the causes for that are acute liver failure because of hepatitis B or hepatitis A, hepatitis E, acute liver failure because of autoimmune illness, or acute liver failure because of Wilson's disease. So these are the range of conditions where liver transplant becomes necessary and useful.
Okay. Are there any criteria being a liver transplant donor?
So, thank you for asking this question. So, when we are talking about liver donor, so mostly we are talking here about living donor. So, what happens is whenever there is a person who needs a liver transplant, so anybody from the family who is having the same blood group or who is having blood group of O positive or O negative, in that case, that person is eligible to give the part of a liver to the patient. And this person, apart from matching this blood group, will need to have a healthy liver. That his liver or her liver should not be fatty. Over and above, once this is confirmed, what we do is we get done a CT scan and see what is the volume of liver that donor is having. If the volume is adequate for the donor as well as for the recipient, then and then the person can donate. In India, only a legal relative of a person can donate organ or a part of organ to the patient.
Okay. Then most common question regarding the liver transplant, that are there any chances of any complication or potential risk after liver transplant?
So liver transplant by and large is a very technically challenging and most complicated surgery of the which is done in the abdomen. So it is technically challenging, but I would say there are still some complications which people should know about. So once we put liver, that liver is not the person's own liver. It is belongs to somebody else. There is always a chance of rejection. But these rejections can be treated very successfully, unlike other organs. Second problem, these patients are receiving medicines which are called immunosuppressants. And immunosuppressants will reduce the immunity of the patient and will put them at risk of contracting particular type of infections. So they need to take care of themselves, maintain hygiene, and should not, attend very large gatherings and stay away from the infected person. So this is the second most common problem. Apart from that, these immunosuppressive medicines can have, say, 20 to 30% chance of, patients getting diabetes or hypertension. So these are the few, side effects of getting a liver transplant. If we talk about liver transplant procedure itself, then procedure itself have a success rate of about 95%. So in 5% cases, patients do not do well, and these are the patients who are already very sick before transplant. And the reasons they do not do well is uh, the liver which we place in them, they do not function well, or they have infection, or other complications which can occur are bleeding during the surgery, or say kidney failure after surgery. So these are the few risks and complications which can arise after liver transplant.
Okay, so thank you so much for sharing everything or each and every detail regarding the liver transplantation, and that awareness is, I think, very, very important. Dr. Bhavesh, let's conclude the entire topic of hepatitis and liver transplant. We have talked each and every aspect of both the conditions. If I ask you the last question, how to bring this awareness or educate to the society regarding the liver health or overall holistic health to just maintain well mental and physical plane?
First and foremost important thing in conjunction with the 28th July, get vaccinated for hepatitis B because it is vaccine preventable disease. Once you get all the 3 doses of hepatitis B, you are lifetime protected because most of the people at some or other time require some injectable form of treatment, and if they are vaccinated, they will be protected or they will not have hepatitis B in lifetime. So vaccination is must. Regarding for liver health, I will say avoid using excess amount of alcohol or do not drink alcohol, do regular exercise, have preventive health checks after 40 years of age. If you are obese, diabetic, hypertensive, get treated properly, get your doctor uh, and get treatment from him properly so that your liver is getting protected. Overall, exercise, vaccination, healthy lifestyle, and regular checkups are important.
Okay. And lastly, thank you so much, Dr. Bhavesh Thakkar and Dr. Vikas Patel, for joining us on this talk. Thank you.
Thank you. Thank you.
Thank you.